Dr. Kevin McHale from Cape Regional Health Systems and Penn Orthopedics, the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. We are deep into the football season, but both a lot of healthy teams here. But, Doc, we always know the Sixers can come through for us when we want to talk about injuries. They always seem to give us something new and exciting, don't they?
Yeah, it's definitely the case. It'd be nice if the Sixers wouldn't keep us so busy, but that's definitely the case.
All right, let's inform people about J.J. Redick's injury to his left leg. He had X-rays negative, and MRI revealed a bone edema and a small cortical crack in the fibular head. I think I probably butchered all of that. But in layman's terms, what are we talking about here? Because we know with the Sixers, when they say approximately 10 days to 2 weeks, sometimes their time frames are a little wonky.
Yeah. So as we know, the Sixers time frames aren't always that reliable. So in general, when we're talking about the fibular head, we're talking about the top of the fibula. A lot of times we talk about the fibula when we're talking about the ankle injuries, when you break the bottom of the fibula, when you dislocate your ankle or you break your ankle. In this case, the fibular head is at the level of the knee, and that's a really important structure because that's where there's multiple ligaments that attach to that and provide stability to the knee joint. So we talk about the LCL oftentimes, and the LCL is one of the things that attach to that fibular head. And it's really important to providing what's called various stability to the knee. And then when you kind of push a knee into that bow-legged position, the LCL stops it. So when you have an injury to the fibular head, it could happen in one of two ways: either direct contact and like a collision right into it, or a stress of that LCL that could have caused that cortical crack or that crack in the outside of the fibula with the reactive bone edema, which is just bruising at that level. So really, you pretty much treat these patients as if they sprained the LCL, but this is kind of that situation where it's a bony injury instead of just a ligamentous injury, and which is actually good for healing. He'll likely be out for at least a couple weeks. They'll have him a hinge knee brace to protect it while it starts to heal. In isolated LCL injuries, sometimes it can take up to 6 to 8 weeks to heal, but a lot of times players get back to playing sooner in a hinge knee brace. So, 2 weeks is possible. I wouldn't be surprised if it's longer than that, but I would expect to see him back to play and with a knee brace on there to help protect that area.
They said he'll be reevaluated in approximately 10 days to 2 weeks. So I guess no thought of him playing in the next 2 weeks, but you think it should be within a month he could get back out there?
Yeah, I think it's pretty reasonable. When you look at, there's actually a study in NFL players with isolated LCL sprains that are pretty significant. They can get back to playing in football in about 2 weeks. All right, so with a brace, obviously. So with this situation, I think it'll be longer than 2 weeks for him with the bone involvement. It'll likely take a little bit to allow it to heal before he gets back there. But that being said, I think that within a month is definitely a possibility for him.
Okay, the other one is Markelle Fultz. We've talked a lot about him, but we're still talking about him, Doc. So are you surprised that he is still not ready to play? And with the fact that he is not ready to play, do you think that this is still the shoulder that's giving him problems, or it's got to be something else? I mean, does he have the yips? Is it something in his head? Is he not confident? Do you think that shoulder, there's a potential that could still be lingering?
So I think it's a combination of both issues. So the problem with scapular dyskinesis, which is what they described, that abnormal motion of the scapula to try to accommodate for some old injury. At this point, that underlying injury likely is completely healed. But the problem is that when you have scapular dyskinesis, when that injury had occurred, it threw off his motion and that rhythm of the scapula when he's using his shoulder, and it obviously threw off his shooting technique. So the first thing is they have to, stabilize that scapula, get in the right position, strengthen the muscles around there that stabilize the scapula and the rotator cuff. And then after that, it's gradually getting back to all these sports activities. Now, for him, he's nearing the 3-month time point. I think it was 2.5 months out now. You would expect to see him turn the corner and getting there. And I think that's part of the thing where part of it is a little bit of a mental issue. It's retraining your body to do that high-level skill that you had that was so natural in the past. And unfortunately, it's really hard to predict when that form is going to return. It seems like he's shooting his free throws a little bit better in practice, but, we want to see him, that shooter that we drafted, and it's very difficult to predict when that's going to be.
But you see that he, some of this video, he still has kind of a hitch in it. It just seems like, man, could this injury that seemed pretty minor, it seemed like a rest thing, still be lingering 2 months, 3 months later. It just seems bizarre that the shoulder that seemed like a pretty minor injury would still be a factor.
Yeah, it's unfortunately not bizarre. And the reason is the scapular dyskinesis has an issue. That abnormal motion as a result of that minor injury can take a very long time to recover. So they sent him to see this doctor, Ben Kibler. He's one of the, world-renowned experts in this condition. And he writes a lot of research on this topic, and unfortunately, it can take up to 6 months for it to be completely corrected.
Wow.
Now, I don't think that's the case for everybody, and I would hope for Markelle Fultz we see him much sooner than that, obviously. But unfortunately, with this type of problem, it can take a long time and a lot of therapy to get people back to their, original level of function. But I mean, I don't think any of us want to be waiting that long. So we hope it's much sooner than that.
All right, and of course the injury report, great stuff to get us up to date, because the Redick thing, it didn't even look like there was much contact there. He just kind of came up lane and just started grabbing right around the under part of the knee there in that game. And sometimes when you have a non-contact injury, you really get worried, like something snapped or got pulled. But hopefully about a month for him, and we hope to see Markelle Fultz back. Dr. Kevin McHale, Cape Regional Health System, and Penn Orthopedics, the best of both worlds for a healthier life. For an appointment, call 469-463-CAPE or visit caperegional.com/orthopedics. All right, you got Patriots and Eagles, two teams you got, used to work with the Patriots, and, of course, growing up around here, an Eagles fan, so you might be conflicted again like you were a couple of years ago.
Yeah, well, this weekend is pretty easy. I can root for each individual team. So hopefully I can become conflicted at the time of the Super Bowl, but I'll hopefully still be rooting for the Eagles at that point. You got to root for your home team no matter what, but hopefully we'll be looking at an Eagles-Patriots Super Bowl.
All right, Doc, we will catch up next week. Appreciate the time as always, pal.
All right, sounds good. We'll talk to you guys soon.